Hello and welcome. My name is Wes Smith. I'm the clinical director here with Cyberspace and Hospice, and I thank you for taking your time out of your day to watch this video. Welcome to Hospice and Provider Services, presented by Cyberspace and Hospice. My name is Wes Smith. I'm the clinical director here at Cyberspace and Hospice. I've had a history of being a licensed vocational nurse since 2006, received my RN in 2009. Had experience with medical surgical floor at the hospital setting, as well as experience in long-term care. And I've been with Cyberspace and Hospice since 2009. So what do we think of when we hear the word hospice? Ugh, death, right? So what do we do when we hear someone is going on hospice? Well, we get the chicken ready, as well as the casserole committee, get them on the phone, because we know from past experience that when hospice gets called in, the funeral is going to be in about 2 weeks. Who is Cyberspace and Hospice? Cyberspace and Hospice was founded in 1986 by a group of local civic-minded individuals who saw their community needing an organization that could help their friends and families get through the most difficult last weeks and months of an illness. We are a Christian faith-based organization, nonprofit, community-owned, and we are committed to caring for individuals touched by life-limiting illnesses, grief, and loss. Cyberspace and Hospice has offices in Mount Pleasant, Paris, and Sulphur Springs, and we serve over 16 counties in Northeast Texas. Cyberspace and Hospice care is available to all hospice-appropriate patients in our service area, regardless of their ability to pay. Our mission statement is honoring life by promoting comfort, care, and compassion, and serving those 16 counties. We are the only nonprofit that covers all of those areas in the northeast corner here of Texas. We are CHAP accredited. CHAP is the Community Health Accreditation Program. It's similar to JACO for hospitals and those kinds of things. So basically, it is a higher level of standards that is higher than the state and even Medicare require us to be held at. The core values at Cyberspace and Hospice: we serve our communities with heart, H-E-A-R-T, honesty, empathy, accountability, respectfulness, and teamwork. Again, we service these 16 counties here in Northeast Texas, basically the whole corner. I think we left out Bowie County on this map, but we actually do cover corners of Bowie County there as well. Cyberspace and Hospice serves all. We serve Medicare, Medicaid, private insurance, private pay, charity or non-funded patients by the support of charity patients through donations and fundraisers within the counties we serve. Care is provided to all citizens of Northeast Texas, serving those 16 counties, all ages from birth to death. The kinds of care: there are curative care, which focuses on curing an illness and the prolonging of life. Palliative care focuses on comfort and quality of life that may be provided with other treatments. And then hospice care focuses on comfort and quality of life when a cure is not possible, with specialized care and services. Hospice philosophy of care is a special kind of care. It is palliative care, it is holistic care, it is patient-centered, family inclusive, and compassionate. Hospice offers palliative support care to a terminally ill patient who seeks comfort from the symptoms of their disease rather than a cure. We offer highly trained, dedicated team of individuals to support the patient and their family with their physical, emotional, and spiritual needs. Hospice is not about giving up, but rather living your best life in the face of a terminal illness. The first U.S. hospice began in 1974 with the foundation of providing services to those who can no longer benefit from curative treatment and have a life expectancy of 6 months or less. Most hospice patients receive care at home or nursing facilities, and occasionally they receive care in hospital settings. We provide support and care to those in the last phases of a life-limiting illness. That 6 months prognosis is diagnosed by a physician. It is literally the physician's best guess that a patient has 6 months or less. We recognize that dying is part of the normal process of living. It's the final part. We do affirm life. We want folks to live as long as the good Lord has them to live on this planet. And we want them to be able to live and not just be alive. So we neither hasten death nor postpone death. And we focus on quality of life for individuals and their families, as well as their caregivers. We have levels of care. There's routine home care, and that occurs wherever the patient may live, whether it's a home, nursing facility, in an apartment, in a hotel room, in a camper trailer down by the lake, wherever they call home, we can service them there. Respite care is when we provide up to 5 days in a nursing facility to give the caregiver a much needed break whenever they are burnt out and or do not have the ability to take care of the patient in the home. Continuous care occurs wherever the patient lives, but it cannot be delivered for patients who are in this next level of care, which is the general inpatient level of care, which can be at a contracted hospital, nursing facility, or at an inpatient hospice unit. You've probably heard of hospice houses. That's what they're talking about when they talk about a hospice house as a inpatient hospice facility. Who needs hospice services? Anyone who meets these general requirements. Life-limiting illness, prognosis is 6 months or less if the disease takes normal course as diagnosed by a physician. Lives in our service area. Consents to accept services and foregoes other medical interventions for the terminal illness. Those hospice services include physician services, routine visits by an RN case manager, an LVN as well, to monitor the patient's condition. Hospice aides can provide personal care for the patient. Chaplain services for patient and or caregiver. Social workers help with emotional and practical issues, resolve conflicts, and provide support and prompt discussions on arrangements that need to be made. We have bereavement counseling available to help the patients and their loved ones cope with that grief and loss. We provide medical equipment, supplies, prescription medications for symptom control and pain relief. We also have volunteer support to assist patients and their loved ones. So who benefits from hospice services? Well, the patient obviously can by having their symptoms managed. They can also meet goals of living the rest of their life in comfort, having the support of experts to minister to their physical, psychosocial, and spiritual needs while going through one of the most challenging phases in one's life. The caregiver also benefits because they have support of experts in palliative care and in hospice care, taking them every step of the way, helping them to navigate these unknown waters. The family can receive up to 13 months of grief bereavement support after the patient passes away. And so hospice services don't end when the patient dies. We have an interdisciplinary group. We are holistic in nature, so we have all of these different team members. By regulations, we must have a physician, an RN, a social worker, and a chaplain. And these guys all have to be involved for there to be a legal IDT. But there are other members of that IDT team. We have the volunteer coordinator, we have hospice aides, we have the bereavement coordinator, we have the attending physicians, the pharmacies, and any other complementary therapies that the patient may need. We have all of those available, and they're all part of the holistic approach to keeping the patient comfortable as long as the patient can be around. Your services as provider services, you guys provide in-house respite care. You have in-facility sitters. You guys do live-in care, meal prep, light housekeeping, personal assist services, transportation services, companionship, dementia care. You guys provide all of this. These are all complementary to that interdisciplinary team. Common myths regarding hospice. We have all heard them. If a patient goes on hospice, they have to give up their doctor. Well, that's not true. We encourage all attending physicians to remain on as they care for their patients because they've known them the longest and they know them the best. And so we encourage them to stay on as their attending physicians and get orders from them and those kinds of things. If a patient goes on hospice, they have to give up their provider service because it's a, quote, duplication of services. Again, false. A patient may retain the services of a paid provider, either privately paid or through a government program, and still receive hospice care. The hospice is to coordinate care with the provider service and either not perform the same tasks or at least not at the same time or same day. So it's not a duplication of services. So if you just have that open communication with your hospice team, we can definitely make sure that we're not duplicating services, and everybody will continue to receive the most care and even more care than they would on one service or the other. Only a doctor can refer a patient to hospice care. Again, false. Anyone can refer a patient to hospice care. Now, they will have to meet the qualifications we talked about above, but anyone can have a hospice consultation to determine eligibility. Another myth, if a patient chooses hospice care, they're going to die within 2 weeks. Again, that's kind of the myth because that's what we're used to seeing because we wait so late to utilize hospice care that turns out to be that way a lot of times. However, there are studies that have shown that if hospice care is initiated at the proper time, patients often live longer than those who seek aggressive treatment for the same diagnosis. So how many of your clients improve and no longer need your service? How many folks that call and need assistance with bathing or need assistance with housekeeping and those kinds of things get to the point where they go, you know what? I'm doing so much better now. I no longer need your services. I would say probably just a handful, right? How many of your clients remain on your services until they go to the hospital, a skilled nursing facility, a long-term care facility, or ALF, or they just end up dying? Probably most of them. So what happens when that person that you're attending goes to one of these different places? You end up getting called off. You get reassigned to another case. The patient's now having to get used to new caregivers, or the family is now having to get used to new caregivers. So how can hospice help you as a provider service? Our goal is to keep the patient comfortable at their home. We reduce hospital readmissions because we have nurses available 24 hours a day, prepared to assist with any symptom issues that can arise and keep the patient at home and comfortable. So as opposed to other modes of care, such as home health, if a patient starts to have an exacerbation of COPD, CHF, or they have a fall, most of the time, home health is going to send them to the ER. The ER is going to patch them up or admit them. We want to send a nurse out first, assess the situation, see what we can do to keep the patient at home and keep them comfortable as much as we can. So keeping the patient at home keeps the patient on your service, which keeps you with steady employment. We come to the patient, reducing the number of doctor visits, which prevents wear and tear on the patient, as well as keeps you out of a crowded doctor's office and reduces the risk of infections, keeping the patient healthier longer. So I'll borrow this from Weatherby Resources. Spheres of influence. So how do we determine decline in a patient? These spheres of influence talk about all the different things where a person is socially in their civic life and the way they're involved in community. So when we're healthy, wealthy, and doing our thing, we're doing all of these things on this screen. We're driving our car, we're dealing with our pets, our memory's good, we're taking care of our own banking, our yards, we're doing our dentist appointments, we're keeping up with our appearances, our health, we're reading, we're paying bills, we're involved in the community, we've got friends, we're doing hobbies, we're watching TV, we're doing all the things that we are involved in because we're doing what we got to do. Well, as we get older and we start having some issues, we start dropping off some of these things. So as you see, we knocked out volunteering, travel, and work, and PTA. Okay, so we're no longer doing those things. Well, time keeps rolling on. We knock out a few more things. planning things, community events, dealing with worrying about politics, making our dentist appointments. That's just too much on our plate to be dealing with because we don't feel like it. Well, we're not driving anymore. We're not dealing with our yard stuff. We're not cleaning up our house. We're not doing our banking. We're not having the ability to deal with all of these things. We're not doing our own cooking. We're not doing our own hobbies. We're still taking care of a few things, but we're already halfway through losing all of the stuff that we used to do. And as we continue, we keep dropping off more and more things and dropping off more and more things because we can't deal with it. We can't cope with it. We can't handle it. Finally, we get down to where we only know ourselves and we have our senses about us, and that's about it. And we have our senses, and then we die. That's decline, right? So if you're having patients, clients who are going through these things, you guys, half of yours are already there in some point because you guys have come in and have helped with cooking, help with cleaning, help with bathing, help with assist to get these people transported here and there and yonder. So that being said, a lot of those folks are really close to being hospice patients. So as the patient's life contracts, the caregiver's life has to expand. So as the things start declining in the patient's life, the caregiver, their life is all the blue dots. They're still having to do all this stuff in their own life. And so now they're adding on their caregiver or their loved ones, patients, medical, MD, doctor appointments. So they're adding that to their list of things to do. They're adding taking care of their patients' loved ones, house cleaning, their foods, their pet foods, their taking care of their safety, making sure that they've got 24-hour assistance. So this is where they, as the caregiver, have probably hired you to come and help out, take this burden off of them and off of their loved one, making sure their medications are being taken. They're losing their ability to hang out with their family and friends, and they're dealing with grief knowing that their patient is declining. They have sadness. They have isolation. They have depression. So as caregivers, that's what they're going through. So you guys, as paid caregivers, you guys also experience some of these things because you all have the blue stuff that you're taking care of in your lives. And now you are hired on as caregivers and taking care of all these red things in someone else's life and trying to make sure that that person gets the best possible care, making sure that their family members are getting the best possible care so that they're able to continue to do the things that they need to do as well. So these are signs of depression or signs of decline that I encourage all of you guys to look for in the patients and families that you guys are serving. Thank you for your attention today. My name is Wes Smith. I'm the clinical director here at Cypress and Hospice, and I appreciate all that you guys do for our communities and all that you guys do for our patients and potential patients. If there's any questions that you guys have, by all means, feel free to reach out to me at Cypress and Hospice. My number is 903-577-1510. If you have patients or caregivers who might benefit from our services, please, by all means, give them our contact information, have them reach out to us. We would love to have conversations with them to let them know what we have available, how we can help take care of their patients, their caregivers, long before they need hospice care so that they can have the ability to make an informed decision with all of the right information. Thank you. God bless. Have a wonderful day.